Good day. This is Niqua Carter, Journeybodyworks-The body mechanic, and I'm here with one of my post-ops. I finally have one of my post-ops willing to get on camera and talk about her experience. Okay, we're 13 days post-ops, and believe it or not, she came in for a consultation a month before her surgery, received 2 massages, and been following the process. So please, tell me if you don't have to use your name, you can just,
All right, so my name is TJ, and I'm 35 years old. I have 1 child. I decided to go for a Brazilian butt lift here in Virginia Beach with Dr. John Mancall. He is the best. I had this procedure done on October 4th, and here I am today. Pay no attention to this. I normally have my garment on, but because of the massage that I'm getting today, it's faster for me to get out of this and get on the table. Let's see. It was an experience. It was a process. I'm still going through the process. I feel great, and I definitely feel like it's because of the massages that I feel this way. I'm in a lot of groups, surgery groups and things like that on Facebook, and ladies are struggling with the pain, with the itching, with just the feeling and the tightness and the soreness. And at 13 days post-op, I don't really have that. I feel great. As you can see, everything's kind of settling into place, and I'm still on my recovery journey.
relax your shoulders.
Relax my shoulders.
There we go.
And these boobs.
Yeah, the boobs. Now let's backtrack a little. Let's go back to your post-op before, pre-op, before surgery. Let's talk about that, because a lot of people don't think about receiving massages before surgery.
Right.
And a lot of people don't think about what type of mindset they have to have with their body and spirit.
Right.
In going into surgery.
Right.
So let's backtrack a little bit. Let's talk about, the first consultation when you came in, your experience, and then thereafter.
Okay, so I was very excited because I kind of stalked Niqua on YouTube, and I saw that she was here, so I started to follow her work many months before my surgery was even scheduled. Like, I was like, this is the person that I want to do my post-op massages. So I decided to contact her. She was super sweet, super friendly, and she's just like, yeah, let's get together. So we did that about a month before my surgery, and that was the best thing that could have ever happened to me, because in that consultation, she pretty much gave me an overview and a rundown of how my life was going to be after this surgery. And I had no idea, like, my mind was blown, but just something as basic as your breath, taking a breath is what is going to help you get through this process. And at first I was like, okay, but when I actually did it, and it got me through some of the things that we've been dealing with now, it was just like, oh God, thank you for those breathing techniques, because I couldn't have done it without it. And I think when I had my massage, I did mine the day before.
Yeah.
The day before my surgery.
You had a massage a week before surgery, and then you had a massage again the day before surgery.
Yep. And my body was so relaxed. When I went into the doctor's office that morning at like 6:45 that morning, I was like, all right, nerves are out the door. You're going to do this. My body was like, yes, girl, let's do this. And I went in and I had a successful surgery, and I came out, and my pain was minimum, of course, because I was on anesthesia. But after that, it was like, okay, now it's time to put in the work. Now it's time to use the tools that Niqua gave me to pretty much get my body together. And that salve was everything. I just want to let you know that.
It was formulated for my post-op.
Yeah.
I started the salve because of my post-op. So I'm happy to know that the salve definitely is working for your recovery.
Absolutely.
It's a big part of it. Yeah.
I put it on, and I had my sisters put it on, and my body just felt like, oh, thank you, I needed that. And then to put the garment on top of that with the compression is priceless.
One of the things that I liked about the fact that you right out of surgery, a lot of women out of surgery, they don't want to love their bodies. They're kind of afraid of it, afraid to touch it, afraid to get all into it, which is okay. Right. But however, you need to love it. And that's what you did, girl. You loved your body from the day you got it back until now. And that made a big difference in your recovery, because you were very engaged in what was going on with your body, and you put hands on it. You used the salve to work it through in between our sessions. So for that, I'm very grateful, because you helped me help you.
Yes, absolutely.
And it's a team effort.
It is.
You did your homework. You trust the process, and now you're getting amazing results as a result of it. Thank you so much for expressing this information with people out there, because a lot of people really don't know. Right. Massages are important. Make sure you budget your massages. It makes a difference from recovering for 3 months, or recovering for 3 weeks, or recovering faster.
Yes, absolutely. I hand to God, like, it is the truth. Absolutely. For real. Yes, I tell people all the time, get your massages, and they say some doctors don't require you to have them. No, that's a myth. Yeah, that's a myth. That body needs to be touched. That the circulation needs to be had. That's the only way it's going to heal itself effectively, faster, with minimal discomfort. Right. Massages are very, very important. Because they said, 6 weeks. I couldn't imagine not having a massage until 6 weeks after my surgery. Like, no. No.
So let's squash that myth.
Yeah. No.
Budget for your massages. Get pre-massages if you can before surgery. It's going to make a big difference on our back end on recovery. And make sure you get your massages after your surgery. Yes. And make sure it's a qualified person that know what they're doing.
And it's not the same as a regular massage that you can go to the massage envy and get. It has to be a special type of training, special type of technique. Everything goes into these massages. So please don't feel like you could just go to, the masseuse and get you one for like $35 over at the school or something. It's not the same thing.
Definitely not the same. Well, thank you so much,
No problem. No problem.
Yep. Now we're about to get her massage going. Thank you.